Good afternoon, ma'am.
Good afternoon.
Congratulations on hospitals.
I'm trying to get it out of the way so y'all can come in. Come on here. No, leave it. Yeah, come around this here.
Yeah, you shouldn't have to move further.
Give me something to do. I wanted to start today by talking about something that I've talked about before, and that is a particular personal interest of mine. We deal with thousands of things across the city from a policy perspective every day, but there are a few things that I invest myself in personally. One is issues of veterans, another is issues of homelessness. Another area that I have championed and really worked hard on is CPR and training everyone to administer CPR, providing better outcomes for those who receive CPR. It's personal to me because my father died of a heart attack. He was well trained in CPR, taught me how to do it, but he happened to be alone when he died. And I know that that was hard, but it's even harder if someone you know is suffering a heart attack and you don't know what to do. And each of us has the ability in our own hands to save lives. We have, in addition, an absolutely outstanding EMS system in Houston. If you're going to have a cardiac event, Houston's not a bad place for that to happen. And we have been on the cutting edge of a lot of tremendous research over the years in our EMS system, public EMS system. And through the work we do, the City of Houston collects an enormous amount of data. And we analyze this data and it informs our decisions on a wide variety of issues, and we make that data available to other entities through research partnerships. Recently, our Public Health Authority, Dr. Perssse, and statisticians from Rice University examined health outcome data related to Houston's air quality. In the course of this analysis, they noted an unequal distribution of cardiac arrests. On further evaluation, they also noted a disparity in the application of bystander CPR. Their findings appear today in the American Journal of Preventive Medicine. Due to the work of our emergency responders, the local cardiac arrest survival rates are among the best in the nation. However, your chances of survival are even better when a bystander steps in to help with CPR in those moments before emergency help arrives. In the longer term, the overall goal must be a reduction in the incidence of cardiac arrest. We have to be healthier, and we all have to take responsibility for our own health. And we have to work together to improve things in common to all of us, like air quality in this region. However, there's this issue of the outcomes of those who do suffer incidents of cardiac arrest. In the short term, the Houston Health Department has initiated a partnership with the American Heart Association to provide hands-only CPR training, specifically in those high-risk neighborhoods that they identified. Those neighborhoods being Sunnyside, South Park, Riverside, Denver Harbor, Magnolia, 5th Ward, and Acres Homes. As of the end of June, 4,520 people had been trained in hands-only CPR. Donna Travis from the Health Department coordinated and led these efforts. And we've done some mass CPR trainings, hands-only CPR trainings as well that I've participated in. But this concerted effort to identify areas where a lack of knowledge may be affecting outcomes is what we're here to talk about today, and what we have done to address that lack of knowledge. With me today is Dr. David Perssse. Houston Public Health Authority, Lauren Ron, and Cathy Ensor from Rice University. And I'm going to invite Dr. Perssse to come up and talk about what they've been doing.
Thank you, ma'am. Thank you, and this is an important topic. We put together a team of folks here behind me, and over the last year or so, what we've basically done is we've taken databases that are very robust. One of the things about the city of Houston when it comes to cardiac care is we have very carefully measured how well we do things going back many, many years, and across the nation, we probably have one of the very most robust databases when it comes to cardiac arrest cases, and we've been recognized for that, and you've reported that before. What we've done today is we've married to the databases, one of them the instance and the location of where cardiac arrests occur, census data looking at those neighborhoods and what are common factors amongst those neighborhoods, and the occurrence or the rate of bystander CPR being used. And what we found is that unfortunately in our neighborhoods that have the highest rate per capita, the highest chance of somebody having a cardiac arrest, those are also the same neighborhoods that appear to have the lowest rates of bystander CPR. And so as the mayor pointed out, what's probably really occurring there is there's a knowledge gap. We also know that when somebody suffers a cardiac arrest, the majority of these cases occur in homes and they occur with family members around. Now, classically we portray the person who's out in the park and jogging and they grab their chest and they go down, and a bystander or a stranger comes along and does CPR. And that's one of the reasons we want everybody to know bystander CPR, because that could very easily occur. But we also know that a lot of the cardiac arrests occur in and around the home, and the person who's most likely to give bystander CPR is a family member. And so we need to get that message out, because there's another incentive for folks to learn bystander CPR, so that there are certain things that make people a little hesitant to do CPR. For instance, we've taken out the mouth-to-mouth part, but for many years people were afraid to do mouth-to-mouth. Well, that's no longer part of CPR, but we need to educate people that it's hands-only CPR, and that CPR actually is very easily done. It is not terribly strenuous, but it is the bridge between when somebody collapses and when the professional rescuers get there. And what we also know from looking at our data is that when somebody performs bystander CPR, it more than doubles that individual's chances of survival. And so as mentioned, here in Houston, we have one of the highest CPR survival rates. And for the people who, sort of the person I described before, who's otherwise healthy and they grab their chest and they collapse, that's called sudden death. And Houston actually has, we have about 25% of those folks go home from the hospital. And we would like to see that number get to be higher, but that's amongst the best in the nation. But there are other forms of cardiac arrest that occur, and of course when the arrest occurs you can't, there's no way you'd have to be in the hospital to know exactly what kind of cardiac arrest somebody has happening. But it doesn't matter in terms of CPR, because CPR is beneficial for all of them, but we have to get people who are willing to get down on their hands and knees, interlace their fingers, put it in the center of somebody's chest and start doing CPR. And the other thing is, when you do CPR correctly, it's not like they show it on TV. If you watch on TV, they don't always really compress the chest because the actor doesn't want their chest to be really compressed, right? But there are ways to learn how to do CPR properly to get the blood moving, and it more than doubles that person's chances of survival. So as the mayor pointed out, we have married up with the American Heart Association. We're bringing you this information today because it went to a journal that reviewed the data. They had their scientists and their statisticians look at the numbers to make sure that what we thought were the results were accurate. They have come out and they've said you are accurate. In the meantime, however, we didn't wait. We got moving with what we thought was accurate information. We got active in the neighborhoods with the American Heart Association, and we've been training folks. And as the mayor pointed out, we've got well over 4,000 people have been trained in bystander CPR in these target neighborhoods, and I personally think that's a good thing for everybody to know about.
Well, I started by talking about the fact that we collect tons of data on lots of different health events, and our fire department EMS system is a full partner in this. This was an incident of looking at one set of data, or a set of data for a particular study, and seeing things that led to other actions. And so I know Dr. Perssse would agree with this, our participation in these different types of studies pays off in ways that we can't anticipate when we begin the process. The American Heart Association, contact the City of Houston. We're happy to help coordinate these as well. Happy to put together training sessions. We do mass training sessions. We also have kits that we distribute to individuals where they can learn themselves and then go out and train other people. we've been trying to track, we know we've trained more than 4,000 people in these target neighborhoods, but we've also trained hundreds of people across the city of Houston. This is an initiative that we want to continue. Dr. Perssse, you're here with a number of other experts, and they may want to talk a little bit about their research. I don't